Hey, everybody, and welcome to Vision Plans 101. Before we start, I want to say a quick thank you to our sponsors with an unrestricted continuing education grant, MacuHealth. So, big shout out to MacuHealth for the grant. So, we will get started, and I'll introduce my partner in crime here, Dr. April Jasper.
We're excited tonight because we get to share with you some of the things that have really changed our lives, our practice, and helped us to be profitable and still help our patients to enjoy their life in our practice. So you guys heard from us last month. I was going to say last year, last month, some of the things that we do. We just came home from the American Academy of Optometry meeting, had a great time, and you can see some of the other stuff that keeps us busy. David and I are in our 21st year. So that means actually we started our 22nd year of owning our own practice. And I can tell you it has been a journey. And I wish I knew, Carl, 20 years ago what I know today, because it would have been a whole different journey. But that's okay. That's why we're here, because we want you to know what we've learned along the way.
Yeah, April, absolutely. I mean, one of the things that we're really here for is to share. We've learned a lot more from the mistakes we've made than what we knew. So we're here really to share that. You can see all the things that I'm involved in today, but really the background for this is 20 years of private practice, 7 locations, and then currently with 3 practices again. And really just trying to share what we know. And the other thing that April and I'll both tell you is when we share what we know and when we're here with you and we expect your comments in the chat and your questions later. We actually always learn more from these than we ever teach. So I'm here to learn because I know you guys will have some great comments for us. And when we start thinking about vision plans and we just start thinking about our practices in general. In most offices, 50% or even more of the revenue comes from the optical and from the dispensary. But most of the time when we're talking with doctors, they'll say, oh, I delegate that to a staff member, or I don't really get involved in the optical. I don't watch the frames. So as we start having that conversation, and we're gonna give you lots of say that different. I'm gonna give you lots of tough love. April's gonna give you all the niceties tonight. I'll give you a little tough love. But 50% of your revenue is coming from your optical, from your dispensary. And it's an area that you're totally ignoring for the most part. You especially can't do that with vision plans, and we'll talk more about it. April, how much space in your office is dedicated to the optical and to the revenue?
Almost half. And I definitely would have it be that in the new office we're designing. I definitely want it the same way. I love it that way.
Yeah, and it's funny how when you go into retail optical locations, they've got 70-80% of their space dedicated to the optical, a small amount to the doctor's component. Whereas most of our practices, we have 70 or 80% to the doctor component and a small amount to the retail. So I think there's a balance there somewhere that we all need to think about.
You know, when I look at this one, Carl, it's interesting because I love on the right-hand side of the slide, we say, what is our strategy to maximize the revenue in both frames and lenses? I think that's the other thing that I really had no understanding of early on, was that in a purchase in the optical, the frame and lens spend or the revenue that we get from that is just about equal. And so when you look at that, it makes you really think about, what am I doing to have a strategy in both areas?
Yeah, and April, we talk all the time about the word "and." So we're not here to say, hey, spend all your time in the retail. And we're going to talk a lot about medical both this month and in future months. But the answer is actually the revenue from the exams and medical, and the revenue in the optical and from contact lens and other sales.
You know, we didn't give them a lot of background on how this all started with us, but I can tell you when David and I bought the practice in 2002, I focused probably the first 5 years on the medical side of the practice, and we doubled, tripled, and then quadrupled that revenue, and saw that our optical revenue was so low. I knew I had to spend time there. And so we're not, again, like Carl said, not saying that's important, but I will take this now and look at what you see here. It's interesting because we bring patients in. Patients that come into my practice, at least, say that the reason they come in is they want to buy glasses. But many times we don't treat them like they're buyers. we treat them as if they came in only for medical care. And then we act shy about talking about the fact that we also sell eyewear.
Yeah, April, most patients, I always think when patients come to the office, if they're not coming in for that medical or that follow-up visit, they're coming in for a reason. Quite honestly, I think they expect to have glasses, or otherwise, I'm not sure that many come in just to be seen.
So as we get started, I told Carl, I want this slide because I'm the one that he said is, how did you say it, Carl? I don't want to say I'm the nice one because that means you're mean, but I am.
True.
Okay.
That's true. You are the nice one.
But I want you to think about this way. I want you to have a little piece of paper next to you or your phone where you can take notes. That's totally fine as well. And as we go through this, I want you to think outside the box. This is time that you spend getting CE, but in the end, I really want you to make money as well and bring value to your patients. So Carl and I want you, as you listen, begin with the end in mind, meaning you're going to go home, you're going to be more profitable when you go to the office tomorrow. And we want you to look for opportunity to where everybody on your team can add value. Now, here's some good news in case we forget to tell you later. This is recorded and you can watch it again later. And so you won't get CE the next time you watch it, but we're totally fine with you having your whole team jump in and watch this again next week when it's out for you to watch on demand, because everybody on the team has value. Look at the office that you're in through the eyes of your patients, not just your eyes. And then if you hear something today where you go, are you kidding me? I've been doing this 25 years and I didn't know that. Don't be mad at yourself. Just be committed to creating new opportunities for you and your team.
Yeah, and then the other thing I'll caution everybody here at the beginning, April, is we're going to cover a lot quickly.
Yeah.
But this is a beginning, not the end. So this lecture we'll do tonight, but in a lot of the areas we're going to go in detail in later lectures and future months, and all that'll be archived for you and your staff as well.
So we're kind of giving you the end of the book before the beginning. And I stole all this from Carl and Katie. The beauty of them having so many practices and so many employees and so much complicated stuff in their life is that they had to simplify the process, and I got to take from them. And we want to give everything to you. They created a consistent protocol. And that's so important because if we're not consistent with every patient utilizing technology and keeping our team involved, then we won't have that success we want to see in our practice. And then we want to create patient tools, and we've done that. We're going to share some with you today and continue down the road. Handouts, apps, things that we use in our practice that help us to be successful. All right, Carl.
The other thing we're going to do, like we try to do with all of our lectures, again, we're going to learn from you guys. Yeah. So the chat box is open. Please put your comments or thoughts in. Share your best practices. We're going to talk about a lot of things. We're not going to talk about money. And here's the other thing, we're both going to be glass half full, and we're going to look at the positives out of vision plans and what they bring to our offices. We all have the same challenges, but managed appropriately in your practice, they can be very profitable.
So we've got some questions for you. So you should see a question popping up, and we sure hope you'll respond. And the question is, what is your biggest challenge, right?
Yeah, what's your biggest challenge in your office today? And we've done this question, April, for 15 years, unfortunately. Yeah. And it hasn't changed a lot. But what's your biggest challenge today? Staff, managed vision plans, not enough patients, online competition, you need doctor coverage or other. There isn't something else that we're not thinking about. And if you put in other, type it in the chat box. Let us know what you're thinking about. So we can either cover it now or we can cover it after the lecture part's over.
Yeah. So the way this is going to work while we wait for your answers to come in, after we finish the 50-minute CE portion, you'll have a chance to join the next session. The next session is not CE. So you can ask us anything you want, and there's no rules in that section because we can just talk. And so we'll carry the questions over into that as well. And we hope you'll spend some more time with us there where we can just talk about whatever comes to mind.
All right. How are we doing on answers here, April?
I am looking still to see. It looks like people are still chiming in. And when you look at this, though, I think, Carl, it's changed for me. Believe it or not, when I first started in practice in 2002 in our private practice, I really thought that our biggest challenge, we had a ton of patients, but we were taking every every insurance known to man. And so for us, that was a big challenge was figuring out how are we going to move from where we're at today to having a higher revenue per patient. So what I didn't know my challenge was moving to a higher revenue per patient. All right, I got an answer. You ready for it, Carl?
Yep. Where are we at?
39% are managed vision plans. So that's the big one. And so good thing they're on this webinar. And 30% are staff. That's number 2. The next one is a tie between online competition and other. So I'm going to go over to the chat in a second and see if they told us what other is. And then need more doctor coverage and not enough patients was the lowest at 6%. Okay. So those of you who said other, we hope you'll throw in the chat what your other is, and we can talk about it in the next session.
Yeah, and that makes sense. I mean, for the last 10, 12, 15 years we've done this, it's always been managed vision plans and staff. I'm actually a little bit surprised that staff wasn't number 1. Seems as I talked to doctors today, that's even a bigger concern than the managed vision plans.
We are excited to have CooperVision as a sponsor of our podcast. CooperVision is one of the world's leading contact lens manufacturers, and they serve eye care professionals and patients in over 130 countries. Their innovative products help millions of patients see every single day. One of the technologies and innovations that we love the most about CooperVision is their groundbreaking technology in soft contact lenses that helps to slow the progression of myopia in children 8 to 12 years old at the initiation of treatment.
So April, what are the things that we're going to talk about on how to be more profitable with vision plans?
All right, we're going to try to get through all 10 in the next few minutes. And I promise you, we won't go into a lot of detail, but we also promise you we will come back with more detail that will help you more.
Yeah, and what I would tell everybody is there's 10 here. You can't do all of them. Pick one tonight and sort of focus on that for the next little bit, and we'll go from there. So the number one thing, and April and I talk about this a lot, is you've got to understand the rules. So let's start with a question here, April, too. So we're going to ask everybody to respond, and we're going to go ahead and give you the answer while you're responding. So April, have you read your, not just your contract, but have you been on the IMED website and read the entire IMED agreement, IMED, the rules of the plan? Have you done the same for VSP, for Davis, Spectera, Avisis, all the other vision plans that you take? Have you done it?
I absolutely have, but I didn't my entire career. I will tell you that. So it's different now. I mean, I read them today. I went back and read through everything today because the last thing I wanted was to give you guys a negative or a wrong answer. And it is a lot of pages, but how many pages do we read in an hour? I mean, we can get through it. Believe it or not, you could get through all of those in a day. And you could get through all of them in a week if you just read them at night, and you will be blown away with what you learn and go, uh-oh. And I told Carl, what's interesting is I didn't know until I reread IMED today that they have the 2024 manual already out. So you can read it. It doesn't go into effect until January, but you can go read it and it updates you on what the changes are. And there are some changes that I think you'll want to know about.
Yeah, in April, we both sort of, we'll see online, or we run into people at different meetings and everybody's talking about how bad the vision plans are. And we're certainly not here to defend them. But this is the first question we always ask, because with most practices, it's 60, 70% of their patients have managed vision plans. And the first question we said, well, have you read the manual? Until you read the manual and you understand where all the opportunities are, and there are a lot of opportunities, then, quite honestly, and this is the tough love piece, not being mean, this is the place where if you haven't read it and you don't know the rules, then you really don't know how bad or how good maybe the vision plans are.
Yeah,
Do
I
we
tell
have some
you.
answers there yet, April, Zane?
Not quite, but I'll tell you what I kind of did, Carl, which sounds crazy, but I did. I bought my practice and I just did whatever was done before me. And I taught a class at Academy on work-life balance. And one of the things I brought up there is the craziest thing I did. I'm not a morning person. Carl is. We're complete opposites. If he texts me and David before 6:30, he will not get an answer. So I'm not a morning person. And I had patients scheduled at 8 o'clock in the morning for the longest time. And all of a sudden I thought, wait a minute, I own the practice. Why am I starting my morning so early when it makes me crazy? And so we moved our morning patients to start at 9 o'clock. We did that years ago, and my entire life changed. It was amazing. All right, here we got some answers. You ready? The no is 75%, but Carl, this is going to blow your mind. 25% of the people on our webinar said they have read their insurance contract and agreement within the past 2 years. So good for you guys.
Well, I mean, that's incredible because April, when we've done this lecture, we've asked that question for a long time too. Yeah. And typically the answer is, it's two people in the entire room. So kudos to those that have read it, and stuff's always changing. And again, we're going to look forward to the chat and what you say and what you tell us.
So why do we tell them here, Carl? Somebody's going to ask us, why do we tell them to print it? We already told them why they should read it, but why print it?
Yeah, you always want to have that reference, and there's times that you need to show it to not only your staff, but occasionally a patient, you'll need to show it to them. But for us, I guess I'm an old guy, so I like it printed, and I like to be able to have the reference, and I like to highlight the parts that really are key parts that we can implement in the office that increase the revenue.
Yeah, and the other reason we always want you to do that, and at least save it somewhere on your computer every year, because if you ever get audited, you don't want to be judged in 3 years for the rules that exist then. You want to be judged for the rules that existed at the time of the year of your audit. And did I say that right? Do you know what I mean? You want to know the rules for the time period that you printed the records for, because they will be different and you won't remember. So you won't even know how to defend yourself. So
yeah, and the auditor might not remember either. So
good point.
They're typically ODs that are just doing the audits, and they may not be looking at the same rules.
If you suffer from dry, scratchy, irritated eyes, the problem may actually stem from your eyelids. Cleansing eyelids daily is essential for maintaining healthy eyes, which is why doctors recommend OcuSoft Lid Scrub Allergy Eyelid Cleanser. New OcuSoft Lid Scrub Allergy removes oil, pollen, and other contaminants from your eyelids to effectively reduce redness, irritation, and itching caused by seasonal allergies. These pre-moistened wipes are easy to use, on the go, or at home. Simply wipe and leave on. As the industry standard of care, OcuSoft has a full line of eyelid cleansers for various conditions. Available through eye care professionals, most retail outlets, and Amazon.com. Visit OcuSoft.com for more details.
All right. So we talked earlier and already about how important it is to play by the rules. We are responsible for all the claims submitted. And doctors ask that a lot of me, Carl. They want to know. So if they're the owner, but they're not the one that made the mistake, who's responsible? And what if they're the doctor that saw the patient and they're not the owner? How does that work?
Yeah, it's you as the owner are always going to be responsible. So remember, you're going to be responsible for the claims that your office files. So that means all of your staff. And then also your associate doctors. Remember, it's your tax ID number that it's being filed under. So really, it's all going to come back to you. Now, obviously, there are some stop gaps in there to relieve some of the liability. But, the reality is you want to be responsible, or I do. I'm a control freak. I want to be responsible. I want to know what's going on in the office. And we monitor it on a regular basis. So we do know what's going on. And it's a good opportunity and a good time to train.
Yeah, I think the other thing too, I saw when we put this together, it says, do not make sure your team are not changing codes. And you might think that that would make no sense at all. Why would anybody change a code? But it happens. They don't know the purpose of you doing things the way you do. And sometimes you don't get all that training done. So it's really important that they understand these are the rules of the game. This is why you do it the way I've had it set to do it, and make sure you're checking checks and balances to make certain it's being done right, because ultimately we're responsible for everything our associate doctors do as well. So train them, don't educate them. It's better for them to know. All right. We like this question because it helps us to know where you guys are. So what % of your patients are on managed vision care plans. And hopefully I gave you the categories right. I think so. And you might not know for sure, but give it a guess. And I think I told them already, Carl, when we bought our practice 23 years ago, it was over 70%. And now in our practice, we are at about 35%. So we're in that 3 category. And we kind of changed it on purpose, but sometimes it happens because you want it to. Sometimes it just does.
Yeah, I think, April, your practice is a little bit unique. I think you've been very intentional
Yeah.
in your practice on how you've changed it, and you're in a market that can do that. If you look just at the numbers and at the average, there's 330 million people in the U.S. About 225 of them have some sort of a managed vision plan. You layer on top of that the federal plans. Included in that is the 93 million that have Medicare or Medicaid and the CHIP program. So I think most offices, I'm going to be really surprised if it's not skewed to number 4 and 5 here of well over 50 and a fair number over 70% with managed vision plans. So be interested to see what this result comes back. Or do we have a group of outliers here tonight that have read their manual and have done a little bit more of what you've done than what's really going on out there?
All right, here's the answer. So 39% are at 51 to 70% managed vision care. Over 70% is 24% of our audience. 31 to 50% is 24% of our audience. 0 to 10 is 6%, and 11 to 30 is 6%. So the biggest group is 39% at number 4.
Yeah, and then total, if my math was right, between 4 and 5, 60% of the audience is over 50%.
Yes.
So understandable why they're here and why this topic's important to them.
So what I wanted to do originally, as Carl switches the slide, at the beginning, I really wanted to remember, and I didn't, to have you guys think about as we go along where you can increase your revenue every time we go. So be watching. I promise we're getting there. We're just kind of setting the stage for why you want to be in that space. But the first thing we want to make sure everybody understands is there's a lot of places you'll find that you truly are making mistakes. One of those is in how you bill for medically necessary contacts. And the good news is all the rules are right there on the website. They're right there in the manual. And I like printing it as well, because then I can give it to my team that is doing a lot of that billing, show them exactly what to do, highlight it, go over it with them a few times. And then I like to randomly check those EOBs when they come back to make sure that we're getting paid correctly. That way you make certain that those VDT measurements, that different, both IMED and VSP will pay for those. Those are the special measurements you take when you fit them in a digital lens. Medically necessary contacts, make sure your pricing strategy is set right. We'll talk about that a little bit. And then be very consistent with vision versus medical. Carl and I are going to talk about that later. And all patients treated equally, what that means. And the way I interpret that in my practice is be consistent in the way you sell, so that every single time, and even fitting contact lenses. So every single time a patient comes in, they're offered the same opportunity for the best products.
Yeah, and April, that's where those protocols are going to come in. We're not going to talk a lot protocols tonight, but a strategy for your practice, having set protocols, and it makes it easy on staff. It makes it easy on associate doctors if you have multiple doctors, if you have a consistent way that you do everything in your office. And then we're going to talk about non-covered services. And I'll just tell you, our view on vision plans is we look at vision plans a lot of ways as marketing. We accept that discounted rate. It's really not insurance. It's a discounted fee for service that we've agreed to accept, but we spend zero on marketing. So we're able to capture patients, have them in the office, and then once they're in the office, whether we're profitable really depends on us, our staff, and our processes and protocols to be profitable.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
All right. So processes that we put in place, one of them is just making certain that we look at our lab bills to make sure that we've received all of our discounts that we should have, and warranty on any job that should have a warranty. And I'm going to show you a process that we use to do that. We also look at our frame bills to make sure we got the right discounts on those. And then we want to make certain, as I said before, that our EOBs come back correct. I want to know that when we're submitting our claims, we're getting paid for everything the right amount, and we're getting paid for the right products and services. So that's something to watch. I know, Carl, you guys have had stories over the past of insurance plans not necessarily paying correctly.
Yeah, all of these things, and especially now, it's all computer generated, and you have a discussion, whether it's your lab bill or your frame bill or your other bills, or the way your EOBs get claimed. Once it's keyed in and once that process is going, if you're not really checking what your contract is versus what you're getting paid, then a lot of times there's inaccuracies in it. So it's always good to go back and take a look at those. And we had one of those for a number of years. One of the insurers was only paying us for one eye on one of the charges that we had. And, fortunately we caught it, but it went on for a fairly significant amount of time. We've had times when on the difference between the invoices and the statements wasn't reconciling back on different bills. So all those processes certainly important.
So let's talk about non-covered services.
Let's talk about some of the non-covered services and how you do that in your office.
Well, one of the ones I love the most are nutraceuticals. And if you look at the value, the dollar amount, when you sell an annual supply of even just one vitamin, and we'll talk about that at the end, it can be as much as $300 a year in revenue. And I'll never forget a patient that came in. She had LASIK and her vision was great, but she comes in for her annual exam. She's very faithful. And in the old days, I'd have a patient like that come in, and I had doctors tell me in the past, I know this is shocking, but they would tell me, hey, if you have a patient like that never buys anything, don't pre-appoint them. Well, guess what? We pre-appoint everybody. I love it. And here's the deal. When she came in, we went through everything with her. She bought dry eye products. She bought accessories. She had sunglasses. She bought her vitamins for the year, and her revenue, the revenue per patient for her that day was over $700. And so the way I think about it is everything you can sell in your practice that your patients are going to want, I want to have to some extent. Obviously, there are some things that you're going to sell very little of and don't waste your time, maybe, but that's up to you. I really think of our vision plans as marketing that brings patients in my door. And now what is it that I'm going to do for them and have available for them that they're going to buy somewhere anyway? And readers, Carl, does anybody buy readers anymore?
Yeah, I think, you take nutraceuticals. If I was going to pick one off the list, I would say readers, and we had it on there, but readers / sunglasses. I mean, that's what patients are already coming in to buy. The readers are over $1 billion industry. Sunglasses is a huge industry. And we can talk in later about some protocols that we've both used to be able, especially with contact lenses, to get patients to buy sunglasses. There's a statistic that's around that basically says within 1 week of a new contact lens fit, new contact lens wearers, 87% of them buy sunglasses.
Yeah.
So if we're not selling them to them, somebody else is. So how do you package and put that together? We'll talk about that in some future presentations as well. And then April, I know you guys do a great job on multiple pairs. Talk to us about how you do it.
It has gotten better over the years because we have continued to learn what to do. And I think that one of the things that I was weak at before, I didn't have enough of any brand to really represent the brand. So I think that's really important. If you look at those frame boards over there, maybe the wood color is getting old, but I still think it's a pretty picture. That's my office as we built it in 2012. And it's about to not be our office anymore. We have to move. But still, when you look at those frame boards, you count the frames. I feel like it's really important. And the way we have them organized is we'll have a brand at the top, another brand at the bottom. You could do them by rows as well, but I would say at least have 2 rows. Otherwise, I mean, patients come in asking for brands from us all the time. And when they do, they want to have enough. When they don't come in asking for brands, then it doesn't matter. But if you want to sell multiple pairs, you want to have enough to represent the brand. You want to start with the best and sell multiple products as well. Like Carl said, sunglasses, computer glasses, and I'll show you a form here in a few minutes that we use to help us do that.
Yeah, and we'll talk about that in the future too, a little bit more on going deeper and wider with a smaller number of frames, and then the same in your contact lens space. There's lots of reasons to do that we'll cover sometime later in a practice management presentation. April, I think you use this as one of the processes on how to get those multiple pairs.
We do, yeah, and we added 2 more questions. One of them is regarding, I think it's headaches. I think we added one in on headaches to help us with selling specialty lenses. But we continue to adapt, and specialty treatments have changed. Every time we have new health and beauty items, we add them to the list. So this has changed, but here's the big deal about this. On the left, where you see 1 through 6, patients answer those questions for me. And then when they come in, I make a massive issue, big deal about talking to them about those things. So they come in and I say, oh, wow, I see that you're a librarian. And I love that you love to be out in the sun and you do this, whatever their hobbies are. They spend 6 hours a week, they told me, on the computer, and they have 2 monitors and they suffer from glare at night and they can't stand. They have to take out their contacts at 3:00. All right. So right there, you sold contacts and 3 pairs of glasses, because there's nobody that can use a progressive lens when they have monitors side by side. And when you walk through it like that with patients, it makes all the sense in the world. You're not selling anything. You're the first one that bothered to tell them what they could do to make it better. So over on the back side of the form, which is what you see on the right, I have all 4 types of glasses, contacts, health and beauty products, and we circle something for everyone and everybody. And this keeps us consistent too, Carl, because I do this, my associate doctor does this, and ideally she and I would have the same revenue per patient if we're both consistent and doing the same thing with our patients.
Yep, absolutely.
And this is what we use when we actually go out into the optical to work with patients. I fill out all those blanks on the form. Then they go out into the optical and we try to make it simple by just saying, let's pick the lens type, material, treatment, and then we go from there. It's a fast process. We have a matching form that we use that they are going to fill out to send home with them if they don't purchase. And it just makes it so it's not selling.
Yeah, and I think that's the big difference is we just have to educate our patients. And if we educate all of them the same, let them make the choices, then, take care of the patient and the practice will take care of itself. And I know that's what you do. Yeah, and then one of the other ones is we offer a retinal screening, for all patients that come in at a fee. We charge a fee for that. In our largest office, we see about 550 to 600 new patients exams in a month. So if you convert even as low as 50% of those at that dollar amount, at that revenue, and I've seen people charge anywhere from 29 to 49 for this. We're somewhere pretty close to the middle. And so, if you do that revenue every month, you certainly pay for the screening. And then the other thing, it's good patient care. Patient here with optic nerve head drusen that was picked up. And it's also a tool then to educate patients, whether you're converting to medical or just on the health of their eyes. And it's a lot of times, again, something that doctors have not taken the time to show them the picture, to talk through with them and provide just a little bit of patient education on why they should be coming to your office on an annual basis. April, this is really your category, the premium lenses and add-ons. And we could spend an hour talking about this topic, and I think we're going to in the next few months between lenses and frames. Huge opportunity.
We'll give you just a few tips, I guess. And yeah, we don't want to take too much time, but I think the one thing that I would say is be careful where you price your products. I've heard doctors say over and over that usual and customary doesn't matter when you take vision plans because all you get paid is what the insurance pays you. And that's not true because many of the plans you get paid a percentage and it's a percentage of your retail. And even if it isn't on your first pair, it absolutely is on your second pair. The other thing many people do wrong is they give a massive second pair savings outside of what their insurance plan requires. And if their usual and customary isn't high enough, they just gave everything away. You're just selling glasses now for the heck of it, and it's a waste of your time. And so I would be really careful with that. I didn't realize for the longest time that second pair savings profitability absolutely depended on your usual and customary fee. I showed you the selling guide that helps you to know how to easily walk through products in your practice with your patients so that your patients don't feel like you're upselling. And then the ordering guide that we have, and we'll show you those in upcoming webinars. That's how we put together, if we are going to sell this category lens to a patient, what lens do we then actually order that's going to be the best for the patient and the most profitable for the practice and be consistent. We don't need to have 500 lenses that we're ordering when we go to place those orders. We talked about watching the EOBs and then important to compare that savings statement that the insurance gives you with your fee slip to make sure that you didn't make any mistakes. And I've also heard doctors, Carl, say that if they make mistakes, they never go back to the patient for the money. And I would say, well, if I make a mistake in their favor, I'm going to go back and give them the money back. As long as I find the mistake that I've made that's in my favor, I'm going to do the same thing as long as I find it in a decent amount of time. What really stinks there is if you go back to them 3 weeks later and say, hey, I messed this all up. You owe me money. And I'm still not saying you can't. That's up to you guys. It's just a little bit more difficult if you find it 3 weeks away instead of today or tomorrow. You've seen this already. Again, it just make it fun, make it easy, and it makes it easier to sell the products that patients want, make it easy for them to understand.
Yeah,
I think you put
again,
this
there's
together.
a lot we could cover there with
Yeah.
lenses. And I think, people do a decent job of that, understanding, and we'll get into categories at some point in the future as well.
Yeah.
But I think the place that people are the most confused about is the frame component.
Let's talk about it.
Let's talk about the frames a little bit. So base question, and again, this is a topic that we'll probably spend anywhere from 45 minutes to an hour in the future, just going through and really breaking down how to quite honestly, the profit is made on frames. It's a little bit like real estate. You make the profit when you buy them, not when you sell them. And the two components are how you buy the frames, what price you're paying for the frames, and then also how you're pricing the frames. And so retail pricing strategy, as April talked about, is huge. So the question is pretty simple. Do you understand the difference between wholesale frame allowance and retail frame allowance? And especially with the managed vision plans, it's critical that you understand this basic concept. And it's like a lot of things in life is it doesn't make any sense because actually the more you pay for frames, the more profitable you're going to be. And I know that sounds insane, but we'll talk you through it briefly tonight. And then in a future episode, we're going to spend an entire episode on lenses and frames and how to both buy and decide on your product mix, your retail pricing strategy, and then what to do. So April, this is your topic. Do we have answers yet?
Not yet, but I will tell. We do. Here we go. 78% say yes, they understand the difference between wholesale and retail frame allowance, and 21% say no. So we're still going to talk about it the same. Those of you who know the difference, that's awesome. Now let's just all be on the same page with what we do with that understanding.
Yeah,
all
I
right.
think that's a good point, April, is understanding the difference and then how you implement into your practice. There's a big leap there. And I see some of the people that are on tonight, and there's some folks on here that are doing a great job that actually could probably teach this as well or better than we can. So
they probably have taught us.
They probably have. I probably took this from some of them.
So what I love about this is, and I say it all the time, I've had doctors come up to me and say, "Hey, I've heard what you said. I understand now what to do, but for some reason my team keeps selling the wrong frames." And I would just say, then don't have them on the board any more than I would have the wrong contact lenses. I mean, there's a lot of everything you could have in your office, but choose to have what's going to make you most profitable and that your patients are going to love the most.
Yeah, and that's going to come down to your overall strategy for your practice.
Yeah.
And then as far as what you want your practice to be, and there's lots of ways to be successful. And then, as we said earlier, going wider and deeper with a smaller number of frame lines.
So I think that when you go to buy frames, the one thing it's important to do is to make sure you work with your vendors. I don't mean this to be in any way negative towards anybody out there that is a vendor, but many of the times they don't understand these rules. I would say 99% of the time, they'll tell you they've been doing this for 20 years, but once you explain the rules to them, they'll be shocked that they never had anyone tell them before. I don't know that they're purposely trying to do anything to cause you trouble. They just don't understand. We're going to tell you right now, watch out for those low wholesale frames because those are the ones you're going to not make any money on. You may not lose, although I would say you lose because you lose in the opportunity that you had to make money on another kind. Educate on your frame board reordering. So when your vendors come in, they know in my practice that we don't want anything in our practice that's under an X amount of dollars wholesale frame allowance. Otherwise, I make no money. And we remind them every time they come in. And then on the frame board reordering, we make sure that they understand that's what we want to reorder and not anything different. Which frames work better for different plans? You have to look to see, do I like the luxury lines, designer, or the high profitability, high profit frames best? And we're going to walk through some of that with you.
Yeah, and it really comes down to, your most profitable are going to be your high-end luxury frames, and what we call your high profit frames. And there's very few of those out there. The reality is there's very few of those high profit frames. And then the third category that we carry that everybody really, I think, needs to carry are just those brand names that people come in asking for that you have to have. They may not be the most profitable, but they do drive patients in. And those patients also tend to have disposable income, and they're the patients that you can do glasses and contacts, or you can do other things. So April for the 21%, and as a reminder for the rest of us, let's talk about wholesale frame allowance. So talk us through this slide here.
And this matters most with VSP, of course. So when you print out of authorization, you can see in one more click, I think Carl's going to bring up a red box around what is WFA. So basically what that means is that is the patient's allowance if the wholesale frame allowance is that amount. So in our practice, if it were that 65, then we would make sure our frame reps know we don't want anything that in frame facts is a WFA, wholesale frame allowance of 65 or less. Now, of course, I got to be careful. You are required by insurance plans to have a certain number of frames that are within the amount that's covered by the insurance. So read both because I take 2 vision plans, but read all of the manuals for all of your vision plans to make sure you're fulfilling that contract. And those are the frames that Carl and I would say you want to make sure you buy those with a great profit margin, because that money that you're going to make on those is all going to be in how you bought them, not in how you sell them, if all you get is what the insurance pays. What you don't want to have when you have those that are under 65, in this case, based on this, you don't want to have the one that you paid 55 and it's listed in frame facts as a WFA of 55, because then all you make is what the insurance gives you, which is covering that cost plus your dispensing fee. So you lose money. Just kick those all out of the office, in my opinion.
Yeah, anything that's a brand name that patients are going to come in and ask for, all of those frames, and this is what sounds crazy to everybody, is, hey, on these, don't buy the $45 frames, buy the $70 frames. And it sounds crazy. So you got to buy the $70 frames, you got to price them appropriately for your retail sales, is the only way you'll make money on the frames. buying the $45, $50 frames. If your wholesale frame allowance for the majority of your patients is $65, then as April said, you're basically not making any money at all in your optical on the frame component of that. And typically, if you're doing that, then there's a lot of other things that we can help you with in being profitable.
So again, how do you do this? How do you sell more of the luxury ones? Especially, you want to have enough to create excitement. Buy above WFA. That's our frame rules. Have point of purchase materials that help to get people excited about it, and consider your profit margin, as you see here, if you do stay under WFA for those required numbers. And then we definitely recommend, there's no other competition. Let me say it this way. There's no competition for the one thing out there that gives you the way to be able to calculate the frame WFA. So Frames data is the only source out there that tells you that. You can have an electronic version. It actually links with your insurance plans, and you can have the print version. But that's the way you can be certain that you're actually typing the right number into your office management or practice management system, so you charge your patients the right amount as well.
All right, April, let's look at a couple of other things on your process here.
Yep. So again, have enough to sell, merchandising, the frame tray. So if you click to the next one, Carl, I think it shows them the frame tray, and here it shows you a little bit of merchandising. You don't have to do it our way. We actually change our windows up all the time. This is just one of the ways we did it in the past. Next one, I think, shows the frame trays.
Do you pay for that advertising there from the company?
No, we do not. So even if what we do is we can use a marketing budget. They give you marketing money. You can use that, but we never pay to have them made. We never pay to put them up. And once you start using companies to do such things, they will compete for your window space.
All right, super. And
we use a
frame trays.
Yeah. So if you remember the form, and I think I'll show it to you at some point, we might show it again. I don't think so, actually. It had 4 different pairs of glasses. And this one on the left, a good friend of ours, Dr. Mazza, put that one together. We showed a lot of folks this one on the right that doesn't have the names on it. You can go with no name. You can also put the names and print it on the tray. But the idea is that as a patient is looking in your optical for glasses, you're going to walk around with a tray because you're expecting them to buy 4 pairs, not 1 pair. And that's the concept here, is set that expectation to improve not only luxury frame sales, but multiple pairs. It's been amazing. What a game changer.
All right, April, let's jump in and talk. And we've got a lot more about the frame piece that we could cover. And again, we'll do that in the future and talk some more specifics. But another big area that you can increase profitability is with subspecialty care. And, we talked about this a little bit last month as well. It's a great time to be an optometrist. The demand is huge. The disease states for the elderly patients are going up, but also the recognition of needing subspecialty care, or being able, the services being in such demand that if you want to carve out your own unique subspecialty type practice or specialty type practice, you certainly can. Pediatrics, the need there is huge. There's not enough pediatric ophthalmologists. A lot of optometrists in their practice have made the strategic decision not to see children. And then there's a huge underserved population. So, if your heart's there, and this is practice, this is from our office, and we actually see a fairly significant special needs population in kids, and it's very rewarding. It may not be the most profitable, but at the same time, when you take care of those kids, there's a stickiness to those patients and to their families, also to other patients that see it. And the other benefit's staff. When you're doing that and they feel like they're really providing a service and helping, there's a stickiness to the staff as well. Obviously, medical optometry, specialty contact lenses, and there, I think specifically if you're thinking about ortho-K or myopia control or scleral lenses or other specialty type lenses, huge demand for that. Dry eye, vision therapy, and probably several others, April, that we're not even talking about. Low vision and others. Neuro rehab, TBI. So lots of areas where ODs are doing it. and where it's an opportunity, if that's your passion, I would encourage you to follow it.
Well, we made it all the way to 6 so far. We're at premium contact lenses, and this is another passion of mine because as we talk through this, those of you who know me know that the other way we built our practice. So I don't know that it was planned, Carl, but it just kind of happened this way. We bought the practice. We went into medical, bought a bunch of technology. We had our OCT, we had cameras, visual fields, everything you could buy medically. Then we ran to the optical and said, what do we need to do to be more profitable there? And then I really started to focus more on contact lenses. So as we jump into this next category, we have a question for you. Do you have different levels of contact lens fees? Let me say that again. Do you have different levels of contact lens fees?
Yeah, and so April, I think you're going to go into a whole discussion here about standard contact lens fitting versus premium, and whether you divide that by toric and multifocal, and then other more advanced lenses, and how the vision plans reimburse for those. And then a topic I know you want to jump into as well is going to be the annual contact lens quote refit or evaluation.
Yeah.
So as people are putting in, I'll be interested to see what they are. But why don't you go ahead and talk to us a little bit about the way, just, just talk to us about how you do it in your office.
So I think that sometimes we do things again the way somebody did it before us and not knowing, because this isn't something you're taught. I didn't. And in the past, we would charge one fee for a contact lens evaluation. And then strangely enough, one patient would take 5 minutes and another patient would take 20 minutes. And I started to realize this made no sense. Did more research and found the insurance actually pays you or allows you to charge your patients based on the tier of contact lens evaluation. And so if it's a toric lens, if it's a multifocal lens, whatever that level is that you've created in your practice, you should have a different fee, in my opinion. And it should be commensurate with the time, the energy, the education, the knowledge it takes for you to do the work you're doing. And because the insurance companies include follow-up visits, it should include the number of visits maybe that you think it's going to require in addition. All right, so let's see what you guys say. 85% of you also have different levels of contact lens fees. 14% do not. So the 14% that don't, we just made you a bunch of money. And this is why, because you can have those different tiers. And if you're worried about changing what you haven't done in the past, it's okay. The first year, those patients come back, the return patients, it might be a little different for you to walk through, but we can help you with that too, having that conversation. After the first year of going through that, it'll all be easy. Here's the different levels. Remember, tiers, higher level is a higher charge. And I look at contacts as a marketing strategy as well.
Yeah, it's definitely a patient retention strategy because it's really clear, and that goes to what's your overall contact lens strategy. And
yeah,
again, we'll do a full hour that we'll talk about this and how to limit the brands you've got and what lenses to fit and how to stagger those fitting fees. But everything that April is telling you is, it's not what Carl and April, got together at the academy and made up last week. Everything she's telling you, I think all this verbiage, April, is straight out of the IMED manual. VSP has similar verbiage on exactly what you can do, how you can charge. So that bottom point on there in particular, April, I think is pretty important.
And that one means basically if you take a patient where your strategy is that for anybody with 0.75 or more of astigmatism, they should be in a toric lens because now the lenses are so good, the patients are going to see so much better. Okay, so I start down that path. And then for one reason or another, the patient ends up in a spherical lens. The rules state that you still should be charging a premium fit because you did premium work. And so it doesn't matter where you land, it matters where you start. As long, again, as you're consistent, which is something we said at the very beginning of this entire talk, just be consistent every single time and you'll win with your patients trusting you and you being more profitable in the end.
Yeah, and April, the contact lens data is so clear on the number of patients that could be in a multifocal that are not. the number of patients that could be in a toric lens or not. So again, in my mind, if you don't offer those products to patients, you're doing them a little bit of a disservice. It doesn't mean that they're going to buy it, but I think it's our job to provide solutions and to offer the opportunities to all of our patients.
Standard fit, you can see, is just what you see here, but basically it does not include, that's the bottom statement here, it does not include extended wear. So if you're putting a patient in a spherical lens, but it's extended wear, that would qualify as a premium fit. And the reason this matters is because it's a big difference in money. So if you mess this up, or oops, you just didn't know, go back and change the way you do it. Read the contract and you'll see the difference. And it'll make you, I'm keeping track for you of the money you're going to make based on changing these habits. And it's significant. Here's some other rules. You can look at these.
Yeah, and all the follow-up service. And again, this is straight out of the manual. So we're back to, number one, know the manual and read it.
Yeah.
But I think that bottom one down there requires more than two. If a patient requires more than 2 follow-up visits, not including INR, you may charge them. Now, the key word there is may. Doesn't mean you have to. The only thing I would say is if you're going to charge, again, be consistent with the policy in your office for your sanity, for your staff's sanity, and for your associate doctor's sanity. Retail pricing strategy, and we covered this a little bit. So, Willis asked the question. We've already given the answer. Before tonight, I guess the question is, did you think that retail pricing matters with vision plans? And the unequivocal answer here is retail pricing strategy it's not that it matters. Retail pricing strategy is critical on how you charge for everything you do. Your base exam, your contact lens fittings fees, your additional services, your non-covered services, and your frame and lenses. As April said, a lot of the charges are based on percentages. It's not a straight line number that patients pay. So retail pricing strategy is key. This is the time in the live audience, if somebody's here, that somebody raises their hand and says, hey, Carl, you're bilking patients, you're just trying to make a lot of money, you're taking advantage of them. And my answer to that is always, absolutely not. I think I am charging a fair price for a value exam materials that we're providing. And I think in today's world, as much as ever, you've got to do that in order to be profitable and to stay in business and to take care of patients. And just as critical today, and as number 2 on things that we worry about, is you've got to be profitable enough to pay your staff to be there and help take care of those patients and to stay and not leave your practice. So look, nobody wants to take advantage of patients, but at the same time, it's perfectly acceptable to run a profitable practice and make a profit. April, I can tell you're dying to jump in. What you got?
I am, but I'll tell you, 89% said that yes, retail price matters. So we're doing a great job, Carl. But, I have to laugh because there was a time, we go up on our exam fees every year. And I remember one year, one of my employees said, what do I say to somebody when they come in and I tell them the price has gone up? And I said, well, first of all, you don't have to tell them the price went up. Do you see them coming out of the gas station every time you pull in to pump gas and run to your car and say, I'm so sorry, the price went up this year or this week or this day? That's not the way you do it. And I wasn't being rough or rude. I was just trying to help them understand there is a right way and a wrong way to do something. And yes, our prices have to go up because holy cow, I'm paying a whole lot more to my team and I'm glad they deserve it, but I got to pay my bills too. All right, we're going to run out of time, Carl.
I've made you mean over the years. I like it.
No, I bring value. All right. So we told you what wholesale frame allowance is. Before we end this session, I really want you to understand this whole frame piece. So let's skip to the next one if we can, Carl.
Yeah. And this is going to tie together 2 of the things we talked about. This is going to tie together your wholesale frame allowance, what frames you should buy, what price point you should be paying for those frames, and how that matches with your retail pricing. And this is critical to profitability on your frame. So April, I'm going to let you do the math, and I'm just going to sit and grade you. So it's on you.
All right, so let's do the math, and we're going to try to end maybe like 1 minute behind. Just let me get through these slides and we'll continue the conversation. When we end, just join back into the next one. All right, wholesale frame value, if it's greater than the wholesale frame allowance, remember the WFA on the patient's EOB, then the patient will pay the retail price of the frame minus retail price of the frame minus the retail allowance times 80%. VSP will pay the wholesale allowance plus the dispensing fee, and your profit is what the patient pays plus what VSP pays minus your cost. Okay, so now we switch to the next one, and this is if the wholesale value of the frame is less than. If it's less than, guess what? Patient pays zero. VSP pays the same. Wholesale value of the frame plus the dispensing fee. Your profit is what VSP pays minus the cost. So here's where you see you can make a big fat zero, or, well, you'll get your dispensing fee. You make your dispensing fee, or you make your dispensing fee plus. And that's the difference in understanding retail and wholesale frame allowance and wholesale frame pricing.
So April, let me understand that. VSP is always just going to pay the wholesale frame price.
Yes, and the dispensing fee.
Okay. And so, and I'm sorry, I'm going to take the time to do this because it's important to everybody out there.
Okay.
So in this example here, and your wholesale frame allowance is greater than is $65, and the frame you've got costs more than 60, or in frame facts for more than $65.
Yes.
If your retail price on that frame is $200 and the allowance from VSP on that one that we had was $150, means that that's $50 that the patient's going to pay 80% of $50, or they're going to pay $40.
Yes.
Okay, so this is where retail pricing that is important. Because if you had that same frame priced at $250, the patient would pay $80 instead of $40. So that's a $40 difference to your profit based on how you had the frame priced. And I'm not saying that you should be that much over. We'll talk about markups and all those things at a different time. That's just to give you an example that retail pricing matters when it comes to the way that you get paid for frames. And then we'll talk at another time about if you're less than, and again, you do have to have, I think it's 100 frames in IMED, maybe the same in VSP. You've got to have a certain number of frames that are less than the wholesale allowance.
Yes.
But, you know, if you do that appropriately and your staff's trained, patients are going to choose, you know, a correct frame or a high profit frame